And if you would please introduce yourself again for the group.
Bonjour, my name is Renee Bolio Banks. I'm an elder in residence at the Native American Community Clinic. It's nice to see all of you.
Meg Rich, and I'm going to introduce the rest of the NACC ECHO team. So Michelle, would you introduce yourself, please?
Sure thing. Hi, everybody. I'm Michelle Corcoran. I'm the nurse manager for the MAT program here at NACC. Thanks for joining us.
Which Nikki?
Hi, I'm Nikki Jardine. I'm the infectious disease nurse at NACC.
Tina?
I'm Tina. I'm the HIV non-medical case manager.
Rich. And I'm Kari Robbie. I'm the family practice physician and also addiction medicine physician. And then I'm going to ask our guest speakers to introduce themselves as well from Southside.
My name's Cora Pace. I'm an outreach worker and community coordinator with Southside Harm Reduction Services.
Hi, everyone. Really happy to be here and thank you so much for having us. I'm Grace Hallberg Cain, and I'm also a community coordinator and outreach worker with Southside Harm Reduction Services.
Thank you, Miigwech. So we're gonna just quickly go through the agenda. This is, of course, the Midwest Tribal ECHO. And next slide, please. We have already done the introductions, and I'm going to go through the agenda, and, and then we have announcements.
Sorry.
No, that's all right. And then Southside's going to be speaking about their outreach services. We have no case presentation, I think, today, or we might if we have time, and then we will close. And then as far as Zoom, we all kind of know how Zoom works at this point. I think the important things are that if we have a lot of noise coming from your microphone, we might mute you. Please don't take offense, just can be distracting for other people. And then also no public health information. And then of course, introduce yourself in the chat function. Excuse me. Next slide, please. I'm sort of going off script here. Sorry, Tina. Okay, and then I'm going to turn the announcements over to you.
So just a reminder that we meet every first and third Wednesday from noon to 1 p.m. The next session will be March 16th, and Susan Bolio from the University of Minnesota will be returning to do a part 2 of her ACEs and historical trauma presentation. And then on April 6th, Dr. Robbie will be delivering a presentation talking about why buprenorphine. And then just a reminder also that there are other echoes that talk about opioid use and addiction and substance use disorder and harm reduction. So Hennepin Healthcare runs a few echoes. They do an integrated opioid and addiction care echo and a viral hepatitis echo. The Indian Country Echo program, they're based on the West Coast, but they have just a huge catalog of different topics related to pregnancy and harm reduction and diabetes and Suboxone and all other kinds of things. Yeah, they just have a lot of stuff. And then Stratus Health, who we partner with, has another echo called the Opioid Use Disorder Education and Treatment Echo with Dr. Heather Bell and Kurt Devine. And they also did a MOUD treatment virtual boot camp. That was a live event. It was a few hours, but they did record it and it's on YouTube. So if anyone wants that, please let me know. The link is in this presentation, but I'll send you the link if you want it. And if you want information about any of these other echoes, please do let me know. Case presentations, as many of you know, and some of you don't, they're just a great time for us to bring actual real life cases that we have questions about or are experiencing challenges around to the group that we can talk about. and just share knowledge and wisdom and workshop. So if you have a case presentation related to a client or a patient, I encourage you to let me know, and we can get you added to our case presentations. And then continuing education for eligible people is provided for this presentation. I just ask that you please complete the survey that I send out after the session to get your continuing education credits or a certificate of completion. And I'm going to stop sharing now and hand it over to Core and Gracie.
Okay, I'm gonna share my screen. We have a PowerPoint presentation. So just briefly before we start the presentation, Gracie and I have been doing some community education and meetings with our participants to kind of spread knowledge about overdose prevention sites and really get feedback from our participants about what they want and what they need, and kind of like hopes for a site so that we can keep them involved in any developments. But I'll present this. Okay, overdose prevention sites. Overdose prevention sites and related harm reduction services have been shown to save lives and have an overall positive impact on communities. They provide folks a safe, clean environment to bring their own drugs to use in the presence of trained staff or volunteers who would then respond to any overdoses on site. Most overdose prevention sites also offer other harm reduction services or connections to other services such as drug checking, infectious disease testing, wound care, and lots of referrals to treatment, mental health support, housing, and other resources. There's many different models of overdose prevention sites around the world, and there's many different names for these type of facilities and services. Supervised injection facility can be a mobile or permanent space, but they focus specifically on injection, and we're noticing kind of a trend of staying away from that term just because of how it kind of plays with the public. The new sites that were opened in New York, they have termed them overdose prevention sites because that seems to gain more public support. Supervised consumption sites is just another name that could be for a supervised injection facility, but these can be mobile or permanent spaces, and they also occasionally may allow folks to use other methods of ingestion such as snorting or smoking, and they would provide specific rooms and supplies for that. So mobile spaces can be either in a van, RV, or they can do like a pop-up tent style. They're still going to be operated by trained staff and volunteers, and they'll go to the areas in the cities that they serve that are in most need. And typically they may do like a schedule, like we're on this block on this day, or folks kind of know where to go. Permanent spaces can really look different from each other depending on the needs of the clientele and legal constraints of the area. Some of them are really more strictly medical facilities, and others are more community focused. And the benefit of a permanent space is that there is often more access to other resources, and it provides folks a stable place that they know they can go and often connect with care providers, whereas mobile sites don't offer that, kind of stable place. So intro to the issues, what kind of things, are happening around us here in Minnesota, in Minneapolis, that would be helped by an overdose prevention site. So overdose deaths in Minnesota are continuing to increase. There was an over 30% increase statewide from 2019 to 2020, and that number is still rising. Minnesota has some of the largest disparities in the nation, racial disparities in the nation for overdose deaths. Native Americans in Minnesota are 7 times as likely as white Minnesotans to die of a drug overdose, and Black Minnesotans are twice as likely to die of a drug overdose. There's also currently an HIV outbreak here in Hennepin County, and 69% of all new cases in 2021 were among Black, Indigenous, and people of color. So another big racial disparity for HIV cases. The Minnesota Department of Health states that the outbreak is occurring primarily among people who inject drugs or people who, regardless of transmission risk, have lived or spent time in encampments in Minneapolis and St. Paul since December 2018, or people who are just closely linked socially to either of those groups. Overdose prevention sites, as well as syringe service programs, can help participants connect with regular HIV testing, preventative care, and treatment options. And they can also help assist with, getting connected to case management for folks who are already living with HIV or AIDS. So what kind of impact do overdose prevention sites have on the communities that they're in? The issues that any community faces are always complex and different from other places. So how could an OPS really help us here? Overdose prevention sites help fight HIV and other infections related to drug use, especially when that's paired with syringe exchange, which, when someone goes into an overdose prevention site, there is always going to be clean supplies, fresh supplies available for them to use. And often there will be syringe exchange on site if they need to bring supplies home as well. According to a peer-reviewed study that synthesized findings from 75 articles about the benefits and harms of supervised injection sites, they found that these sites enhance access to primary care and chemical dependency treatment, reduce overdose frequency, reduce syringe litter and public injecting, and nothing has shown that these sites increase crime or drug deals or initiation to injecting or using drugs. Participants that utilize overdose prevention sites are much more likely to begin chemical dependency treatment just due to access to referrals and really having that support. A lot of sites really focus on building relationships with clientele and meeting people where they are at, so that when they are ready to take steps to change, that it's a lot easier because you already have that support and you can trust these folks that you have built these relationships with at these sites. So the cost of overdose prevention sites and harm reduction, that's always a big question, right? We have to know how much money it's going to cost, but actually overdose prevention sites can significantly reduce the use of emergency services and need for expensive, intensive medical procedures, which are going to save communities money over time. These sites provide, wound care on site, supplies for wound care, testing for HIV and other infectious disease, on-site overdose reversal, and access to naloxone and syringe exchange. A study done by Safe House, which is a group in Philadelphia that's advocating for an OPS. Hopefully things turn out well. Their case is still in federal court, so that could mean a really big change nationwide for overdose prevention sites. But they found that by reducing ambulance rides, emergency room trips, hospital visits, overdose prevention services are expected to save Philadelphia about, or at least $2 million a year just in healthcare costs, which is a pretty significant number. So one pretty well-known overdose prevention site is Insight, which is located in Vancouver, Canada, and it was North America's first sanctioned supervised consumption site, which means it was legally allowed to be there. They opened in 2003, and since that time, there have been over 3.6 million visits to inject drugs under supervision of their staff, and there have been at this point, over 48,798 clinical treatment visits. So that's, chemical dependency treatment, primary care, and there have been 6,440 overdose interventions without any deaths. So there have not been any deaths. I don't believe that there's been any deaths at any of the sites in North America. So one really great thing about Insight is that they do have more of a community focus, and drug user unions really work to build this site, and they have a bit more of a community focus, and they got what they call the chill room, so folks can hang out afterwards and socialize and build relationships with other folks with similar lived experience. As I mentioned, drug user unions and drug user networks play a vital role in fighting for overdose prevention sites and harm reduction resources and just the rights of drug users across the globe. The international network of people who use drugs is a really huge network, and they connect folks literally all over the world who use drugs and want to fight for the rights of their peers and themselves and their loved ones. Yeah, I kind of already said this, but they also offer folks with these lived experience an opportunity to meet with others and build relationships, and sometimes it can feel very isolating because of the stigmas around drug use. So being able to find people that have similar lived experience as you, that you can build relationships with and work towards something is really important. So I'll turn this over to Gracie.
Yeah, just a quick question too, maybe for you, Tina. Usually this is where we would break for questions, just because it's a pretty long presentation, and I'm about to talk a little bit about legalities, so really kind of changing the subject. Would it be okay to break for questions, or is it best that we just wait till the end?
I think go ahead. Yeah.
Well, yeah, if anyone has questions about that first part, yeah, go for it.
If you wouldn't want to take down the presentation so we can see everybody, then just for a moment, that would be great.
If nobody has any questions right now, that's okay too. We can have questions later.
Thank you.
So yeah, I'm just going to talk a little bit about overdose prevention sites and kind of like the current routes of local and state authorization, as well as like just a little bit about federal authorization. And towards the beginning here, just talking a bit about what's going on currently in the United States. There's been a lot of really exciting momentum around overdose prevention sites. Cora just mentioned about Safe House in Philadelphia, and they have been in that federal court case since 2019. hoping for a verdict this spring, I believe, which could really shape and really direct some of this momentum, whether or not they are able to win that case. Some other really exciting news, as it says here, in the United States, overdose prevention sites are not currently legal on the federal level. And many states and local governments have prohibitive laws against them. However, New York City, as many of you probably know, opened the first 2 authorized sites in the country. One of the sites, which is in Washington Heights neighborhood, is a community focused site, which Cor kind of spoke a bit on earlier. So yeah, that's a lot more geared towards like peer support and like spending time, like usually having like community spaces, and a lot more like participant, like folks using the space would be having more like organizational power and like leadership within the site. And oftentimes in those sites, we've seen that community members will receive training and overdose reversal and response, and kind of be the ones to run the site. And then the other site in New York City that just opened is in Harlem neighborhood. And that's medically focused. So that's gonna have a lot more like medical professionals on site. So cool that they kind of have both of these different options, or yeah. Let's see, yeah, cool, thank you. Other exciting news is that in July 2021, the governor of Rhode Island approved funding for an overdose prevention pilot program. And that is supposed to be opening up this spring. So hopefully that goes through, because that's also very exciting news. Yeah, and then I guess I kind of covered Safe House and what's going on. So some other cities that are currently kind of heading this fight for overdose prevention sites and are really kind of building momentum and organizing their communities are Seattle, San Francisco, Denver, New Mexico, Vermont, and then many others as well, probably that we don't know as much about. Yeah, and as many of us know, the functions of safe injection sites have existed for a very long time, probably as long as people have been using drugs, and as long as like drug supplies and stigma and there's been threats around drug use. People who use drugs have taken care of each other and pooled resources to ensure like community safety and personal safety. And that continues to be the case here in the United States. There are informal and unsanctioned overdose prevention and injection sites, as well as around the world. And currently, there's actually at least 120 legal sites that exist globally. So in 2019, the Drug Policy Alliance did a study for the authorization of supervised consumption sites in Minneapolis and Minnesota. And their findings were that there are prohibitive laws here, both on state and local level, against overdose prevention sites, but that there are also routes to authorization on both of those levels. So I'll just be speaking a little bit on that next. So for state authorization, Minnesota state legislature has the ability to remove legal impediments to overdose prevention sites. So that's including possession, paraphernalia, asset forfeiture, and other charges. The governor could issue an executive order to permit an overdose prevention site. And it may be possible for the Minnesota Health Commissioner to authorize an overdose prevention site through their authority to protect public health. Some of the benefits of state authorization are that overdose prevention sites that are authorized through government legislature, that's able to eliminate the uncertainty about legality on the state level. State authorization would also greatly reduce a chance of local prosecutors and police departments taking formal action against the site, just because that gives kind of a larger umbrella of like legal like safety, I guess, than like a local level authorization would. State legislative authorization would give overdose prevention site the strongest case if faced by the federal court, just because it's that much closer in proportion of power to that court system. So for local authorization, an overdose prevention site can be authorized by a mayor, county agency, or city council. An overdose prevention site could be passed through a city ordinance that would be introduced by the city council and passed by the mayor, which unfortunately our current mayor has publicly stated that he is not in favor of overdose prevention sites. And we did actually write this presentation before the election, so that was a little bit of a letdown. Local authorization would give the weakest defense against federal charges if they were to arise. Oh, and also the mayor could declare a local emergency, which would bring the order for an overdose prevention site to city council for ratification. Another kind of downside of simply just having that local level authorization is that organizers of the site, so that would just be anyone connected to this site, would need to address local legal impediments. Or I guess the organizers would kind of be the ones to address those issues, but the protections for anyone associated to the site would be a bit weaker than they would if we were to authorize, like, say through like state level. Okay, so first steps. These are just a couple of statements kind of about how Southside is approaching overdose prevention sites and kind of like our commitment to this education work that Cora was talking about earlier. And I guess I'll just kind of read through these. So Southside Harm Reduction Services is committed to engaging with communities in Minneapolis to provide education and facilitate meetings and conversations about the possibility of an overdose prevention site. We hope to identify values, needs, and goals for the future of this project. And then that kind of ties in a bit to what Cora was saying in the beginning of introducing this work. Is just we have been meeting with different groups, different organizations, direct care providers, community groups, and we're really in the beginning stages of that and plan to continue these meetings. And another really important part of this work is connecting with folks who use Southside services, a lot of folks who are staying in East Phillips and live there are super interested in a site like this. We've been doing some surveys, we've been having some conversations, and we plan to be having some regular meetings together. So yeah, that's just a little bit about that piece. It could take years for a sanctioned overdose prevention site to become possible. We believe that in the meantime, a harm reduction-based drop-in center could meet many of the same needs as an overdose prevention site. And that's just saying that it's really important that we have a space. And I think that's like just really become clear. And an overdose prevention site really adds that piece of having a place for folks to use substances where they can have immediate overdose response, as well as preventative care, and just kind of like, yeah, is a way for folks who use drugs to have more control over their health plans, and really have a place for care providers, community, and peers to be together and have a shared space devoted to taking care of one another, as well as like using safely. Moving on to the next part is Southside Harm Reduction Services will support community members at risk of overdose to lead decision-making about the creation of this site. We believe that this space should belong to those who use it and will best benefit the community at large if it does. We believe that laying the groundwork for an overdose prevention site will benefit communities by reducing drug-related stigma and supporting relationships based around community safety. Well, and then that's the end of our conversation, or of our, not our conversation at all. That's the beginning of our conversation and the end of the presentation. So if anyone has questions, please ask.
I don't have a question, but I just wanted to give a reminder to the audience that if you haven't already introduced yourself in the chat, please do that so that I can email you the survey link for your CEUs or your certificate of completion.
I was wondering if like in terms of at the state level changing the legislation around this, do we have it? Are there any supporters in the? I don't know don't know the political terms. Do we have any supporters that would help us change that legislation?
Yeah, so Corey and I have been at this for about almost a year now, but we've really only been focusing on this overdose prevention site work for about 6 months. So we plan to kind of reach out to some different representatives and have these conversations and just kind of ask people face to face. I'm kind of uncertain about, I've looked for statements on this from like our governor and like a couple of different officials and haven't had much luck in finding answers to that. But maybe if someone else from who's present has information on that, that would be awesome to hear. Sorry, I don't know.
And then in terms of the components that you would like, I see that you set up 2 models. You said like there's the ultimate goal would be an overdose prevention site, but there's also that piece which is just a community space for people who are unsheltered or using drugs to be and to have a safe space to be. What sort of services does Southside envision or has been shown to be helpful at these sites?
Yeah, so we actually surveyed our participants on this and, asked, what do you guys want? And then, we've had conversations as staff and volunteers, but of course, access to harm reduction services like we already provide at Southside, but having it, be a space they can go to. But the big thing, folks just wanted a place that they could come inside for a little bit and hang out. But other than that, connections to treatment, medical care, just like kind of like a one-stop shop that they can come and, maybe have a designated place to meet with care providers. Ideally, we would be able to, maybe provide some type of like showers, or it really depends on the funding, but really people just want a spot that they know they can go to, and they know that, it's going to be run by people like us that are, not going to kick them out for this or that. Yeah.
Hello. I know you all been working diligently with a lot of the neighbors over here in East Phillips, and I was wondering if you could maybe talk a little bit about that. What's the progress going on with that, and how have the interviews been going that you've been doing with participants?
Yeah, actually they are going, so we've been working with a small group from the East Phillips Improvement Coalition, and we've been meeting with them for several months to work on this concept paper. We helped a little bit with that, and neighbors, kind of came together and wrote pieces of this paper that they hope would be kind of a way to connect with organizations and maybe other neighbors, but they are going to be doing door knocking starting next week, I believe. So we've got this kind of core group of neighbors that are going to be going around and doing some door knocking and providing some, resources to folks about what overdose prevention sites are, and what that could look like in our neighborhood and the benefits. So it seems to be, really taking off, and we've been able to start kind of connecting this group with some partners of ours. So seems promising. Oh, and the interviews have been going really well. We actually did some interviews yesterday and we'll be doing some more next week. Just any way that we can possibly, get feedback from participants and, give them a platform to share their voices and concerns and desires. It's really important. I don't know if you have anything else to share, Gracie.
I did, but I think I lost it, unfortunately.
Is there any, just to sort of, I think that I'm just very excited to hear about this work, and I think it's very much needed and would be so helpful to our community. I'm wondering if people want to get involved or want more information, how would they reach you guys?
I can put my email in here, and then we can, connect folks with this neighborhood group we're working with, or, if there's other ways we can partner and share resources. We're working on like an info packet that we can kind of hand out to folks that has, how to take next steps and, what are overdose prevention sites? How do I talk to my neighbors? So hopefully we'll have that in a shareable format by the end of this month. So that would be great, but I'll drop my email in here. Anyone that wants to reach out would be great.
Yeah, and I'll just add too, so Cora and I are in the middle of kind of putting together this resource packet that they just mentioned. And we'd really like to gear that towards organizations, because oftentimes they'll reach out to an organization that just has so many different facets to it and aspects and so many different people. And we often only meet with a handful of people at a time. So we're really trying to learn some from folks who are working in organizations who may be interested in this, like what should we include in a packet like that, and like what would be useful in talking to maybe like leadership or coworkers, what's important to know as like a direct service provider, someone who works at an organization that does direct service. What's useful to know about these overdose prevention sites, and like what might be useful for sharing with someone who has a stake in this but may not really know a lot about it. So just putting that out there, if anyone has ideas to share or questions about information that you might be wanting, yeah, please let us know. Or if you want to email Cora, that would be great too.
I know one of the things that we're excited about is potentially having telehealth access so people who are using the site can potentially access providers through telehealth, and have a safe space to do that in, and potentially sort of make that first linkage to care.
Yeah, that's definitely been part of the vision, just giving folks that space to, comfortably meet with providers in any way that it's more easily accessible. Yeah, something that has come up a lot when we've talked to folks is really about the way the space looks and feels. And a lot of folks seem to, be a little uncomfortable in a lot of medical settings due to, trauma. So, we've had folks say like, nobody we don't want people wearing lanyards, and we don't want it to look, you know, really sterile and medical. So having like a really comfy, community-oriented space that can provide these resources would be really huge.
I have a question. This is Michelle. How many or how common are just drop-in centers at this point? Are there very many? And how easily have people kind of created those or gotten those started, if that's the first step?
Yeah, that's actually something we've been trying to reach out to some folks about, because, you know, this is something that Southside may be able to get funded for, and it has been, like Gracie had mentioned, this overdose prevention site in Washington Heights was a drop-in center, a community drop-in center that they have turned into an overdose prevention site. We reached out to them a couple months ago now and haven't heard back. They're pretty booked up with media inquiries, as you can imagine. But yeah, we're still kind of trying to research like where all these drop-in centers are, but they do exist. But it really depends on, you know, funding and legal constraints of an area. But I think that there are definitely not nearly as many as we should have. And there are some places that have some of the services, but it wouldn't be, you know, what happens a lot. And this is something that we actually saw when we started working with this neighborhood group, is that a lot of these drop-in centers or community spaces may start as being, you know, oh, this is a place that's safe for people who use drugs, but then it turns into them being pushed out of the space. So that happens a lot. And that's something that we've been really, you know, mindful of as we go through this work, to make sure that people that are using the service are able to use it forever, you know, and their voices are heard. I think Nikki, did that answer your question kind of, Michelle?
Yeah, it did. I mean, I only know of one. I know People Incorporated has one in St. Paul, was like on York. And, you know, they stayed pretty busy, and it was, you know, really an awesome space, and folks could hang out there pretty much all day, but that's the only one I really know about. And I just would love to see something like that. I think it would be pretty easy to kind of transition to an overdose prevention site.
Yeah, absolutely. Nikki.
Hey, I was just wondering, and maybe you guys, I had to hop off for a second, so maybe you mentioned this and I missed it. But I'm wondering if you guys are familiar with Safe Space, the traveling exhibition. So it's the reason that I thought of this is because I think, Corey, you were just talking about like what the space should look like, and like how important that is in terms of comfort and you know, and so anyway, so Safe Space is like it's like a, I don't know, 10 foot by 10 foot kind of like pop-up supervised consumption facility that it's like an art exhibit almost, and it kind of and it travels and it shows like what a space like that could look like, and it's yeah, I can definitely the reason that I know about it is because it was present at one of the White Earth Harm Reduction Summits, like maybe now 5 years ago, something like that. And so I can definitely like give you guys the contact info of the person who knew the person who was connected with it. I mean, it's like a super in-demand thing. And so I don't, you know, but anyway, and I think it's also like it's doing like it as a project is doing kind of very similar things to what you two are doing in your work at Southside, like trying to bring the topic to the community and just like, you know, dispel myths and like make it a sort of tangible thing. But yeah, I think it's a nice thing because it just sort of shows how simple the space can be and how sort of laid back it can be. And I think like attempts to look like non-clinical and anyway, I'll send you guys like what I know about it, but also I thought that was a great point about just making it look like a sort of welcoming, non-judgmental, non-traumatizing space. So
Yeah, like if you even just Google images of safe consumption sites, and you can see, the ones that have like, very, it's just white and brown and mirrors and everything looks the same. And then you got another picture where they have some plants and, cute art and posters, and there's a couch, and like that makes all the difference. Like, of course, you're still going to be safe, using in this medical focus space, but it's just different, I think.
you said there's a couch, and I thought you were going to say there's a cat, and I was like, oh my God, there should totally be cat, like the way you have like a cat cafe.
Yeah.
Like it should be like a cat rescue / overdose prevention space.
Yeah, or at least have like pet therapy days and stuff. That stuff is great. Yeah.
Totally.
Liking where this is going. How about bathrooms? Have you guys, is that something or is it too early to think about those sorts of level of details?
Yeah, we have discussed bathrooms, and that is a huge thing, right? Because people are going to use the bathrooms and use in the bathrooms. So having a very, detailed safety plan, we check the bathroom this often. It's a tough spot because we don't want to kick people out for using drugs, but then there's issues of funding and legal stuff. So just having a good safety plan and just trying to make sure folks are as safe as possible. And, all these things will kind of, the details will be finalized once we know more about like funding and what the space will look like. But yeah, we've had a lot of conversations about this because it's really exciting to think about, and exciting to talk with our participants about the possibilities of these spaces. And yeah, there's a lot to it for sure.
Any final thoughts or questions?
I just again want to thank you guys for all the work you've been doing. Like, as not to beat a dead horse, but like I've told you in the past, we've tried to get things started, and this is really the first time I've seen some legs under it. So I just want to commend you for all the work you've been doing, because it's been a lot, and I really feel a lot of gratitude towards you both. So thanks, and keep going.
Thank you, James. I did just see a question in the chat. What are open hours at these sites? And that really depends on the space. I think Insight is open like 6 a.m. to 3 a.m. or something like that. It really depends on the space. If Southside were to open this drop-in center, which would not be a safe consumption site, it would probably be much more limited hours. But you want an overdose prevention site or a safe consumption site to be open as much as possible, right? Especially late at night, because that's when folks are out, and we need folks to be safe. So
that's definitely a thought. Just as from our perspective as a clinic, the intersecting hours with places of business that offer resources is also something to think about.
Yeah, there's certainly a lot of elements, and if we were to get funding for this drop-in center, we would have to have some time to do some organizing. I know Jack Martin is meeting with a consulting group that has worked with some folks doing drop-in centers and just kind of harm reduction organizing. So this is kind of like the first step to start getting us prepared, because right now all of our services are mobile. We're pretty small, so it'll be a big change, whatever the change is.
It looks like Raven Gibbs raised her hand.
Yeah, thanks. Hi, Cora and Grace. Thanks so much for your amazing presentation, very useful and great content. My name is Raven Gibbs, she, her pronouns. I'm the Native American Outreach Director for U.S. Senator Tina Smith. And the service that our office offers is more of a constituent service inquiry. We have access to the Congressional Research Service. So I'm happy to talk with you offline and maybe see if I can help you out with like an environmental scan to get you more information on drop-in sites across the country and even inquiry and see what kind of funding currently exists. Not necessarily just federal funding, but any kind of funding across the country for like a drop-in center. I can put my email again in the chat for you too.
Yeah, that would be great. Thank you so much.
Yeah, we'd love to connect.
I'm excited. Let's make a drop-in center.
I know.
Yeah.
We have definitely been talking about it.
Mhm.
So I
Yeah, and it would.
go ahead. No, please go ahead.
Oh no, what I was going to say is that, yeah, I mean, like partnering with NACC or other groups would be great, because it would be hard for one organization to do it, and you would just be able to offer so much more if you were to be able to partner. So
Yeah, co-location of services is such an important concept in when creating these sorts of projects. But thank you so much for joining us. I think that was a great great information, great discussion. I hope I'll see you all again in our next presentation. What's the date, Tina?
March 16th, and Susan Bolio will be returning to talk about ACEs and historical trauma.
Yes, and that was a request from, I think, the last time she was here to bring her back. So we made that happen. So I hope that you guys can join us for that.
And if people didn't see the first half of her presentation, that's probably on our YouTube channel, right?
It's on our
So-
YouTube channel. Yep. And I send that out in the email too. So.
Okay. Meg Witch, thank you. Have a great day. Thanks for all you do.